अस्सलाम वालेकुम एवरीवन। आज हम स्टार्ट करने वाले हैं अपना पहला मॉड्यूल विच इज़ द ब्रेस्ट सर्जरी एंड वी आर गोइंग टू स्टार्ट ऑल द टॉपिक्स फ्रॉम अब्दुल वहाब डोगर and Bailey book, some additional information from Bailey. We will add some surgical videos and images in this module, and of course we have to discuss some important topic related MCQs in this, and my recommendation is to watch this video on maximum speed to save your time. Just talk about the surgical anatomy. So in the surgical anatomy of the breast, first you should know about that breast is a modified sweat gland, right? So what is the extent of this breast? That is vertically between the second to sixth rib and horizontally sternum to anterior or mid axillary line, right? But some of the breast can extend from the clavicle to eighth rib. Note this point. So just talk about this image. So we know that this is the nipple, and the surrounding of the nipple is the areola, right? And inside this areolar duct there are many ducts goes towards the nipple. So they are the lactiferous sinus and the lactiferous duct. जो ये दो डक्ट्स होती हैं, इसका क्या मकसद है कि जो लैक्टिफेरस साइनस होती है इसके अंदर मिल्क कलेक्ट होता है, where the milk collects, and the lactiferous ducts where the milk travel towards the nipple, right? So there are the lactiferous sinus and lactiferous ducts. So talk about the most important functional unit of this module of anatomy, which is the terminal duct lobular unit, written on the fourth line of the Dogar. So the terminal duct lobular unit are of two types: extralobular terminal duct and the interlobular terminal duct. So the extralobular terminal ducts are those which is outside of the lobule. So this is the lobule, and what is this? This is the extralobular terminal duct. And what is the interlobular terminal duct? So this is the lobule, and inside it this is the interlobular terminal duct. So this one is the extra terminal lobular duct. So this lobule has a bunch of acini. Watch this. So these are the bunch of acini, and this bunch of acini makes the lobule. So in next 2 or 3 modules we will also discuss about the fibrocystic disease, in which that acini increases in size. If you saw this picture, so this is the acini occur, and it travels toward the interterminal duct, toward the extraterminal duct. Through the extraterminal duct it drains into the lactiferous duct, and from the lactiferous duct it goes toward the nipple, right? Hopefully you clear that point of the surgical anatomy. Just talk about the stroma. Basically stroma has two types, and it is the adipose tissue, which is basically the fat, and the stroma we will discuss the fat appearance on the mammography. So there are two types of stroma: the interlobular stroma and the intralobular stroma. The interlobular stroma are the stromas which is present between the lobules. For example, this is the one lobule, this is the second lobule. So between this is the interlobular stroma. What is the intralobular stroma? So this is the lobule, inside it, so this everywhere, this is the intralobular stroma, which is basically the adipose tissues or the fats. In the Dogar book, on the first page, there is also the mention about the keratin. So keratin is the protein. It It is a protein and it is present on the outer layer of the nipple. So this is the nipple, so there it is present, and it is responsible for the structure to maintain the structure and the integrity of the nipple. So next one is about the Cooper's ligament. So what is the Cooper's ligament? As you know that हमारे पाकिस्तान में जब न्यू घर बनते हैं तो जब हम गेट लगाते हैं बाहर का, तो हम उन्हें रस्सियों से सपोर्ट करते हैं to maintain their position, to maintain their erect position. The Cooper's ligament here, all are the Cooper's ligament. So they are responsible to maintain the structure of the breast, right? So it is the breast tissues that is responsible for the maintaining the structure of the breast, and you must have to know about it that it is extended from and it is present in the lower half of the breast, right? Lower half of the breast, and they are extended from the pectoralis fascia and attached to the skin. Remember, right? Just talk about the Cooper's versus lactiferous ducts. These are the two most important terms you should know about it. That the lactiferous duct and the Cooper's ligament are what? So these, the yellow linings are the lactiferous duct, where it drains, where it goes into the nipple. So right. So whenever the cancer occur, so this is the cancer, right? So if the cancer involved in the lactiferous duct, so it can pulls the nipple inside. So it pulls the nipple inside. And what is this? This is the retraction of nipple. I will show you the image onto the next slide. And this is the cancer in the Cooper's ligament. So where the Cooper's ligament placed in the lower half of the breast. So this is the Cooper's ligament, and if the Cooper's ligament the cancer is involved in the suspensory ligaments of the Cooper, so it may result in the dimple of the skin. So both the retraction and the nipple we will discuss later on into the next slide. So what is this? So this is the pectoralis fasciae and it is the pectoralis major. जो पेक्टोरलिस मेजर मसल है वो हम जब नेक्स्ट इन्वेस्टिगेशन करेंगे तो उसके अंदर बहुत एक इम्पॉर्टेंट इन्वेस्टिगेशन है पेक्टोरलिस मेजर मसल टेस्ट. सो जिससे हमें पता चलता है कि आइदर जो लंप है वो इन्वेड हुआ है टुवर्ड्स द पेक्टोरलिस मेजर मसल या नहीं, राइट. सो दिस इज़ द डिम्पलिंग एंड द रिट्रैक्शन. एज आई टोल्ड यू कि जो डिम्पलिंग होती है वो कहाँ होती है? कूपर्स लिगामेंट में, और जो रिट्रैक्शन होती है वो कहाँ पे होती है? हमारे लैक्टिफेरस डक्ट में, राइट. जो डिम्पलिंग है वो हमारे जो कूपर्स लिगामेंट है वो हमारे कहाँ होते हैं? लोअर हाफ ऑफ द ब्रेस्ट में, राइट, फ्रॉम द लोअर हाफ ऑफ द ब्रेस्ट, राइट. तो ये क्या काज करती हैं? डिम्पलिंग ऑफ द स्किन. और जो रिट्रैक्शन होती है, देयर आर टू टाइप्स ऑफ रिट्रैक्शन. एक कॉन्जेनिटल भी हो सकती है और एक रिसेंट भी हो सकती है, राइट. जो रिट्रैक्शन कॉन्जेनिटल है इसके लिए हम एक्सरसाइजेस बताते हैं जिससे जो निपल है वो हम और एग्जैक्ट पोजीशन उस पर आ जाता है. और जो रीसेंट है तो इट मे कैन कुड बी डक्टल एक्टेजिया और malignancy, right. So this is the normal nipple and this is the inverted nipple. So if cancer involved in the lactiferous duct. So ये जो दो पॉइंट्स हैं ये आपको पता होने चाहिए जो कि बहुत इम्पॉर्टेंट है एज़ कम्पेयर टू दिस मॉड्यूल, राइट. सो नेक्स्ट वन इज़ द टेल ऑफ स्पेंस. So this is not written on the Dogar, so but you must have to know that whenever the young female lady came to the doctor, complained that I am feeling a lump in my axillary region. So when we palpate or when we investigate, so this is nothing, just the breast tissues here that is growing towards the axillary region. So it is nothing, just breast tissues growing towards the axillary region. Okay, so let's talk about the histology. This is could be very helpful in the when you read about breast pathology, so it could be very helpful to you. So the yellow lining is the epithelial cells, right? And what is this? This is the yellow ones are the myoepithelial cells. So this one. So inside this one is the epithelial cell. So I will give you an example of the myoepithelial cells. You know, it is example of just a lizard. कि जब भी छिपकली को देखते हैं तो हम उतना नहीं घबराते, लेकिन जब भी हम जब छिपकली को देखते हैं और वो डिसअपेयर हो जाए तो हम बहुत ज़्यादा घबराते हैं, राइट? तो ऐसे ही कंडीशंस हैं कि जब मायोएपिथेलियल सेल प्रेजेंट हो तो इट मीन्स इट इज़ अ बिनाइन कंडीशन. सो इट इज़ अ बिनाइन कंडीशन if present. If absent, it going to be malignant if it is absent, right? So but the you should know about the markers of the epithelial cells and the myoepithelial cells. The marker for the endoepithelial cells is CK7, which is the cytokeratin 7. जब हम न्यूप्लाज्मा का चैप्टर करेंगे तो इंशाल्लाह हम वहाँ पे डिस्कस करेंगे. एंड फॉर द myoepithelial cells CK5, 6 or P63. So this is the additional information you must have to know about it. Let's talk about the lymphatic drainage. So in the lymphatic drainage, so there are 3 levels of node, right? So level 1 node, level 2, level 3, and the interpectoral rotors nodes. It is also written on the Dogars, just written there about the rotors node. So you must have to know that the axillary lymph node is about approximately about the 90%. The drainage is through the axillary lymph node is a 90%, right? And the intermammary nodes is about 10%, right? So in the level 1 is about the lateral to pectoralis minor. Please remember, it is not a major, it is the pectoralis minor, lateral to the pectoralis minor. Level 2 is behind pectoralis minor, and level 3 is the medial to pectoralis minor. And what about interpectoral rotor lymph node? So it is between the pectoralis major and minor both, and it is involved in the level 2. Please remember this point because it is very helpful in next MCQs, right? This is the lymphatic drainage. So just talk about the triple assessment. So in the triple assessment, first what we will do the clinical examine plus history. History is must first. And what is second? Radiological finding. Third one is histopathology. So in the clinical examination of history, I will tell you, जब भी हमारे पास पेशेंट आता है तो हम उसको पाल्पेट करते हैं उनके ब्रेस्ट को, ताकि कहीं भी अगर लीजन है तो हमें महसूस हो जाए और हम उसे मार्क करें. तो इन तीनों में आइदर इज़ अ वेस्ट सेक्शन और द कॉन्सेक्ट सर्कल पैटर्न. जो मोस्ट इन्वेस्टिगेशन मेथड है जो हम करते हैं, सो इट इज़ बेसिकली द बेस्ट एग्जामिनेशन टेक्निक इज़ डायल क्लॉक मेथड, विच इज़ दिस. हम जब पाल्पेट करते हैं तो हमें पता चल जाता है कि यार यहाँ पे लीजन्स है. फॉर एग्जांपल अगर 1 o'clock पे है तो हम यहाँ पे मार्क कर देंगे और हम इसे क्लॉकवाइज जो है वो पाल्पेट करेंगे और जहाँ पे हमें लीजन महसूस होगी हम वहाँ पे मार्क कर देंगे. इन द रेडियोलॉजिकल फाइंडिंग देयर आर 2 conditions. Exactly, it contains ultrasonography, mammography, also MRI, but we will discuss about the mammo mammography as well as ultrasonography, right? अब हमने ये दो चीज़ें क्यों डिस्कस की हैं, आई विल टेल यू. So this is the mammography versus ultrasound. So the both are the mammography of the young and old lady. So this is the old and this is the young. So remember, I will tell you one thing. Both have glandular tissues. Appearance is white. Fats, which is black. It also have glandular tissues and fats also, right? If lump is present, what is the appearance of lump? It is also white. So what is the important in this topic is the lump is white, right? So in the young lady there is a increase glandular tissues. In the old lady there is a low glandular tissues. In the old lady the fats is increased and then young lady the fats is decreased. So of course when we do mammography तो हमें क्या नज़र आएगा, ये easily आपको लंप नज़र आ रहा है और जो बाकी जो जितना भी एरिया है ये फैट्स है, which is the black, right? ब्लैक अपीयरेंस दे रहा है. तो हम इजीली फाइंड कर सकते हैं मैमोग्राफी के ऊपर वो उन वुमेंस के अंदर जिन वुमेंस के जो 40 ईयर्स से अबव है, बिकॉज उनके अंदर जो ग्लैंडुलर टिश्यूज़ हैं वो कम होते हैं और फैट ज़्यादा होता है. बट एज़ कम्पेयर टू द यंग फीमेल्स उनके अंदर जो ग्लैंडुलर टिश्यूज़ होते हैं वो बहुत ज़्यादा होते हैं, जिसकी वजह से जो उनकी अपीयरेंस होती है वो टोटली वाइट होती है. एंड यू क्लियरली सी कि इसके अंदर जो ब्लैक एरियाज़ कम है एज़ कम्पेयर टू द वाइट एरियाज़, बिकॉज ग्लैंडुलर टिश्यूज़ बहुत ज़्यादा है, राइट? इसके अंदर जो ग्लैंडुलर टिश्यूज़ हैं वो बहुत ज़्यादा और जो फैट्स हैं वो बहुत ज़्यादा कम है. सो दैट्स वाई हम इसके अंदर जो यंग लेडीज़ के अंदर है वो मैमोग्राफी नहीं कर सकते, बिकॉज उनके अंदर जो वाइट अपीयरेंस है वो बहुत ज़्यादा आ जाती है. मैमोग्राफी ओल्ड लेडीज़ के अंदर क्यों करते हैं और अल्ट्रासाउंड हम क्यों करते हैं? हम अल्ट्रासाउंड को अलग से भी डिस्कस ज़रूर करेंगे, बट दिस इज़ द मोस्ट इंपॉर्टेंट पॉइंट्स यू मस्ट हैव टू नो अबाउट इट. So lot of MCQs from mammography versus ultrasound. So there are two views basically, the CC views and MLO view which we done in the mammography. So what is the CC view and MLO view? Basically MLO is the mediolateral oblique view. So in CC view, कॉर्डल व्यू हम क्या करते हैं, मैंने इसलिए इमेजेस दिखाई हैं बिकॉज अगर मैं आपको वैसे पढ़ाता तो वो शायद आपको समझ ना आती. लेकिन इसके अंदर जो पैडल होता है वो हम ब्रेस्ट को बिटवीन पैडल एंड द प्लेट रखते हैं और हमें जो है वो टिश्यूज़ प्रोमिनेंट तरीके से नज़र आते हैं. बट एज रिटन ऑन द बेली दैट द बेटर रिजल्ट इन द डेंस ब्रेस्ट, better result. So the mediolateral oblique view is the best method in which the tissues are more prominent. The tissues are more prominent. और हम इसको कैसे करते हैं इस तरीके से, राइट? कि जो हम ब्रेस्ट है, इफ़ आइदर इज़ अ लेफ्ट और राइट, हम उसे प्लेस करेंगे बिटवीन पैडल एंड द प्लेट ताकि हमें मोर उसकी जो एग्जामिनेशन है टिश्यूज़ की वो हमें पता चले, राइट? So you must know about these things, and it is in the general surgery of Dogar. So talk about the ultrasound. Ultrasound is the imaging modality of choice. What is this? It is used to differentiate between solid and cystic mass. And it is more common that we done in a pregnant lady with a lump, right? And in the young female with a dense breast, Talk about the MRI. So about MRI, there is a indications that it is the investigation of choice in breast implants. So in this condition, So what we gonna see that there is a difference between the multifocal and multicentric, right? So what is multifocal? किसी एक डक्ट के अंदर, किसी एक जगह के अंदर कैंसर होना, मल्टीपल डक्ट्स के अंदर जब कैंसर हो तो उसको कहते हैं मल्टीसेंट्रिक. So it is the differentiation between the multifocal and multicentric. But one thing you should know about it is that the BCS is contraindicated in multicentric malignancy. What is BCS? It is the breast conservative surgery. जो नेक्स्ट हम मॉड्यूल पढ़ेंगे हम उसके अंदर इसको लाजमी डिस्कस करेंगे. मोर अबाउट द MRI, दैट इट इज़ द मोस्ट इन्वेस्टिगेशन sensitive investigation for DCIS. It is the most sensitive investigation. Please write this information. What is DCIS? This is the ductal carcinoma in C2. It is a pre-malignant condition, pre-malignant stage. That before the malignancy के अभी कैंसर नहीं हुआ, so उससे पहले की कंडीशन को कहते हैं C2, right? लेकिन it is the imaging investigation of choice to identify the local scar. Two things you should know. If अगर पूछा जाए that what is the investigation MRI in which phase it is the investigation of choice, so it is the investigation of choice to identify the local scar and recurrence. But if you talk about the investigation of choice for the distant metastasis, it is a PET scan. So this is the 2 points you should know about it. And we also saw the Ligmini sign. So it is the step pallidary sign and extra capsular rupture seen in exactly as a snowstorm appearance. So the next one is the histopathology. So it is the most important topic, of course, as like the clinical assessments. That FNAC is only cytology. Why I write this? Because it is the fine needle aspiration cytology. So in this case we only got cells, not tissues, and we use 23 to 30 gauge needle. Additional information it is, and it is only the cytology. For what is the, this is new, the fine needle non aspiration cytology. So it is done only for superficial lesions, which is used in breast as well as thyroid, right? So what is this? This is the true cut biopsy, and I also there the KitKat photo. So what is the difference between the incisional biopsy and the excisional biopsy? You know, the excisional biopsy and the incisional biopsy is that when we cut out the whole region, the affected margins, and incisional biopsy just a chunk. This is cut whole and it is just a chunk. Why I place this photo of the KitKat? Because you know, जब भी हम स्ट्रेस की कंडीशन में होती है और अगर हमें कोई ये कहे, अगर हम स्ट्रेस की कंडीशन में और अगर हम कोई चॉकलेट दे तो ऑफ कोर्स हम जितनी भी हो वो हम पूरी खा लेते हैं. लेकिन अगर हमारा मूड ठीक है और अगर हमसे कोई मांग ले एंड अगर हमें शेयर करनी है किसी के साथ तो हम उसे थोड़ा सा चंक दे देते हैं कि आप ये खा लें. सो इन दिस कंडीशन दिस इज़ द डिफरेंस बिटवीन इंसिजनल बायोप्सी एंड एक्सिजनल बायोप्सी. कि जो एक्सिजनल बायोप्सी होती है वो होल की होती है, राइट, और जो होल मार्जिन्स की होती है. जो इंसिजनल बायोप्सी होती है वो जस्ट अ चंक होती है. इसके अंदर एक कंडीशन एक और बायोप्सी होती है विच इज़ द पंच बायोप्सी, ठीक है, जो यूज़ करते हैं स्किन ट्यूमर्स एंड पैजेट्स डिजीज, बोथ कंडीशन के अंदर पंच बायोप्सी. एंड इन द एक्सिजनल बायोप्सी वी यूज़ 8 to 18 gauge of needle, right? So in next one it is the investigation of choice where tissue is obtained. it is the investigation of choice where tissue is obtained, right? So it is investigation of choice to differentiate between the situ condition and the malignant condition. Note about it. So also it is the investigation of choice in the prostate cancer and the soft tissue sarcoma. If you wanna write, just write down. And the gold standard for the breast lump is the excisional biopsy. Gold standard for breast lump hole, it is the excisional biopsy, and if you want just a chunk, it is the incisional biopsy. So it is the BI-RADS score I taken from the belly. I also read about it in the various lectures. So it is the category, you know, I told you about in the ultrasound, in the mammography, that we can't do mammography in young females because there is a high glandular tissues, they are a white appearance, and lump also have a white appearance. We can't differentiate between them, that either she has a lump or not. So in the incomplete category, we need additional views, imaging, to further investigate either it is a cancer or not. So BI-RADS score is just like if a student came to you with a 4/10 marks, so आप अंदाज़ा लगा लेते हैं वो किस टाइप ऑफ स्टूडेंट है. अगर 9/10 का स्टूडेंट आता है तो आपको पता चल जाता है वो किस तरह का स्टूडेंट है. सो बाय दिस BI-RADS स्कोर, अगर कोई पेशेंट आपके पास आता है और उसने BI-RADS स्कोर करवाया हुआ है तो आपको मजीद इन्वेस्टिगेशन की ज़रूरत नहीं होती. यू जस्ट हैव टू सी दैट आइदर दे हैव अ चांसेस ऑफ अ कैंसर और नॉट. सो इन द फर्स्ट कैटेगरी देयर इज़ अ नेगेटिव, we have to do annual screening, no cancer. In a benign, there is a continuous annual screening, no cancer. In the third, there is a short interval, 6 months, 2% of the malignancy, most probably either or not, so 2%, less than 2%. In the fourth, must be suspicious is either malignancy or not, so we should have to do for a biopsy. Three stages हो सकती हैं. A कि थोड़ा हो सकता है, B moderate, or C high. Fifth is the malignant state and biopsy is must required. Two-cut biopsy is required. So 95% of the probability. And sixth one is the malignant conditions. So you just have to go for the treatment, surgical treatment. So please stop the video and take your time to sort out these MCQs. Is that which of the following is not true? Please read again that it is not true regarding the lymphatic drainage of the breast. We also learned that there is a level 1, level 2, level 3, right? So which of the following is not true? The axillary node receive approximately 85% of the drainage. This is true. The lateral group is located along the axillary line. True. The anterior group of drains most of the breast. Yes, true. Lymph nodes are divided on the basis of relation to the pectoralis major. So it is true or not? No, it is false, because it is relation with the pectoralis minor, right? The level 1, level 2 and level 3 all are related with the pectoralis minor. So this is the true. So the second one is the 55-year-old woman present to OPD with 4x2 painless lump in the left breast. So she planned for mastectomy, and sentinel lymph node biopsy done showed involvement of the level 1 lymph node. Which is the following lymph node will not be affected? So in level 1, which is the posterior, lateral, subscapular or interpectoral, which will not be affected? So it is interpectoral because it falls in level 2. I told you, go to the previous topics, and in the lymphatic drainage I told you about the interpectoral lymph nodes, which is a rotor's lymph node. It is falls in the level 2nd. So thank you so much for watching this video. अगर कोई भी ऐसी point है जो मैं मिस कर गया हूँ, so please type in the comment section, and please like, comment and share, and must subscribe this channel. Allah Hafiz.